Good morning, good afternoon, or good evening, depending on where you are. And thank you for joining us for this FIP session focused on resilience. Regardless if you are in Africa, Asia, Australasia, Europe, North America, South America, Antarctica, we know that the last year has been a tremendous year of change, of chaos, of difficulty, but also of opportunity, and perhaps most of all, of resilience. My name is Zubin Austin. I am a professor at the Faculty of Pharmacy and Medicine at the University of Toronto in Canada, and it is my pleasure to act as your moderator for today's session focused on resilience in pharmacy. I am joined by an established array of researchers, practitioners, regulators, educators, people from all over the world. And over the next 90 minutes, we are going to spend time sharing our experiences, our research, and our work focused on resilience in the pharmacy workforce. I would like to invite the panelists to please unmute at this point, and very shortly I'm going to ask them all to introduce themselves. The format for today's session is informal. We have no slides, we have no graphs, we have no data to formally present. But instead, we are going to share with you the work that is being undertaken in all corners of the globe, focused on the resilience of the pharmacy workforce. And our hope over the next 90 minutes is that you will find ideas for how to better prepare yourself for what's happening today and what will happen tomorrow. Let me start by asking the panelists to introduce themselves. First, I would like to introduce Dr. Karen Whitfield. Karen is an associate professor at the School of Pharmacy at the University of Queensland in Australia. Karen, hello, and welcome to the talk show.
Thanks very much, Zubin. So thanks for that lovely welcome.
Now, Karen has a fairly unique role in resilience in pharmacy as the convener, the originator, and the founder of an organization called GRIT. And GRIT is actually the group that is hosting this session. Karen, could you tell us a little bit about what GRIT is, what it does, and what you've done over the last year?
Yeah, so I thought I might start by saying GRIT was formed in July 2019 when I was running a workshop in Prato at the Monash Pharmacy Education Symposium on building resilience in students. There was so much vibe and energy in that room that at the end of that session, I just asked if anybody would be interested in developing a global group around resilience. And there was a lot of enthusiasm for that. And that's actually when GRIT kind of started. So we're a community of practice. We meet monthly. We are made up of a variety of pharmacists, not exclusively, from a range of backgrounds: hospital, community pharmacy, academics, and regulators. And we support each other. We share ideas, and we, where possible, collaborate on projects. And we have a common interest, and that is our passion for developing resilience in our pharmacy workforce. And I'd like to acknowledge the group tonight.
And Karen, why GRIT? What does GRIT stand for or mean?
GRIT stands for Global Resilience Team, and the group is very team orientated. So we thought that was a really suitable name for the group, and it kind of stuck.
Excellent, thank you. Next, I'd like to introduce Dr. Katrina Bradley. Katrina is the Executive Director of the Irish Institute of Pharmacy. Katrina, how have you been spending your pandemic?
Oh gosh. Hi, Zubin. My pandemic has gone all over the place, really. So it started in March when all of us in Dublin, there was a shutdown, the schools were locked down, workplaces, everybody went home, and that was hard. It was, nobody really knew what to do, and the homeschooling didn't work. I am not a teacher for people who are in primary school. I have discovered that. And there was that weird time at the beginning where it was really surreal and we didn't know what we should be doing. Myself myself and my team, we were cancelling lots of the regulatory assessments. We felt we should be going out into shops and stores and community pharmacies and hospitals to help our colleagues because they were really under pressure. Then we all got into the groove. We started realising how pharmacists needed support. We've been working really hard. The team in the Institute of Pharmacy have done great work in developing webinars, COVID resources and networks to support pharmacists. And we've really been led by pharmacists who are telling us it's really difficult being on the front line and working all the time there, but really rewarding. And they very much feel that their patients need them. And their hospitals need them. Personally, I took up paddleboarding. I'm lucky to have the sea within a couple of 100 meters of me, and you know, we've been confined within 5 kilometers for a long time. I'm a little bit optimistic about 2021, but also a little bit worried. I don't know what it's going to be like when the boundaries open up and you can, you know, it's going to be strange going back to normal life. But it's been okay. Yeah, it's been
Excellent.
okay.
Thanks. Of course, the pandemic has dominated much of our thinking and talk around the world over the last year, but the need for resilience in a variety of different aspects of life is not simply confined to infectious diseases. I'd next like to introduce Dr. Sarah Willis, who's a senior lecturer at the University of Manchester in the United Kingdom. And before there was a pandemic, of course, there was Brexit. And of course, that introduces a whole host of other reasons to be adaptive, to be able to roll with the punches, as they say. Sarah, can you tell us a little bit about yourself and your interest in global resistance? Global resilience.
Yeah, resistance. Thanks, Susan. As Susan said, so I'm from the UK, based at Manchester University, and I'm one of the non-pharmacists in the group, so I'm a sociologist by background, and my interest is really in education and training of the medical pharmacist workforce, so I've done a lot of research in that area, and some research around pharmacy students as well. So really great that got to meet up with Karen and other people, other colleagues at Prato, and kind of build this group of shared and common interests. So I've done some research around academic resilience in our undergrads, and we're just about to survey them again because in the UK, our students are currently facing primarily online learning, being isolated. I don't know that anyone will have heard about the terrible press that Manchester University has been having recently about the way it's been treating its undergraduate students. We've had a lot of problems with a lack of support in the north of England, where I'm based, relative to the south of England. So there's been all kinds of kind of wider geopolitical stuff going on, which we think is bound to have an impact on our undergrads and on our workforce. So I kind of have a broad range of interests.
Excellent. Thank you, Sarah. Next, I'd like to introduce Dr. Dalia Bajes, who's an assistant professor at the Mohammed Al Mana College for Medical Sciences in Saudi Arabia. And first, a big thank you to Dalia for actually organizing this session on behalf of GRIT and providing us with an opportunity to share some of our work with the global audience. Dalia, what's been happening for you with respect to the pandemic and some of your work in the area of resilience?
This resilience, isn't it, Zubin? Just to make sure we're talking about that. It's just so lovely being on this panel. I'm absolutely honored, and I'd have to say thank you to Karen for this lovely group of people that we're always meeting, as she said, on a monthly basis. Many of you might know I reside in Bahrain. I've actually also, like the rest of many of you, have been working from home. I've been working from home since March. Because the land borders have closed between Bahrain and the eastern province of Saudi Arabia. So I actually used to commute to work cross-border on a daily basis. And so that stopped for me from the 7th of March. What has the pandemic done to me, or how has it impacted me? Well, I think it's, like Katrina said, it's on many levels, to be honest. On a personal level, not only am I a lecturer and I have commitments for work, but also I'm a mother of 3 teenage girls who also had to go onto online learning. And you know that saying takes about 21 days for habits to form. I'm like, we had to learn how to maneuver all of this and navigate all of this in less than 21 hours. I had to learn how to, do online teaching within, literally days. And so that hasn't really been easy or, really the way that we had anticipated. Difficult. However, from a personal perspective, I guess, my daughters had to upskill in their culinary skills and artistic, skills, but also on a professional level, I felt like I had a duty with my students as well. And so also try to explore this area. I am involved in research. I'm not sure, Zubin, if you want me to talk about this now or a bit later on.
We'll be talking about that in a few minutes. Yeah.
Yeah, but so it hasn't been easy sailing. However, I think I am also quite hopeful and very positive for the coming year, bringing out a lot of our kindness and the teamship that we've really, all of us have experienced during the pandemic has been absolutely astounding. So Thank you, Zubin.
And thank you, Dalia, for also reminding us that even though we just happen to have the opportunity to be speaking on a panel focused on resilience, each of us, the speakers on this panel, we've all had our own struggles, and we've all had to demonstrate our own kind of resilience and figure our way through this, whether it's dealing with children and online schooling, managing cross-border commuting, or trying to figure out how can we do the best job that we can as teachers, as practitioners, or as regulators, given the circumstances we're in now. If there is perhaps a face of global resilience amongst our panelists, I believe that face would be that of Dr. Kyle Wilby. Kyle is the Associate Dean Undergraduate and Associate Professor at the School of Pharmacy at University of Otago in New Zealand. And why I say that is because for Kyle, it is 2:12 in the morning. So first of all, Kyle, thank you for either A, waking up early, or B, not going to sleep tonight so that you could join us. And Kyle, tell us a little bit. In New Zealand, how have you been dealing with the pandemic?
Thanks, Zubin. And yeah, we've got the espresso still going here. So, and it was
That's how you've been dealing with the pandemic.
Yeah, the beauty and I are having a little bit of a coffee date at the same time. Well, I'm quite fortunate, to be honest. New Zealand's, I think, has had, due to geography and different reasons, has had quite a good pandemic strategy. And after a first lockdown back in May, despite a few different scares, we've kind of come out of it quite well. I think I'm representing here some expats in the pandemic. So I'm originally Canadian, and definitely empathize with those that are in different countries that are unable to, for instance, go back to see family and friends, that kind of thing. From my capacity here in New Zealand, I think I can bring a lot of insight into what it's been like to be in online teaching and then go back to in-person and then back to hybrid and then back to in-person and then back to hybrid again, and kind of that yo-yoing that I think many areas of the world are kind of going through at the moment too. Some of the research I've done is in specific aspects about how students have faced racism in the pandemic, especially our international students, and the implications for student support and different services needed, as well as working with Vibuti on different aspects related to systems resilience. So looking forward to discussing a little bit of that tonight here.
Thank you, Kyle. And thank you for the lead in for our next person to introduce. That's Dr. Vibuti Arya, who's the Global Lead Equity and Equality for FIP. Vibuti is based in New York City in the United States. And boy, if there was ever a country that needs resilience right now, it's probably the United States. Things have been, how to put it gently, Vibuti, quite interesting. And so perhaps within pharmacy, but also politically, sociologically, there's a lot of challenges that Americans are facing now, perhaps more than many other places in the world. How have you been managing all of that?
Yeah, how many hours do we have again? Yeah, it's, in every sense of the word, it's been very humbling, very challenging. So also as a mother of two little girls, 3 and 6, and living in a 1-bedroom apartment in New York, which is, all my urban people on the call are like, yes, that's how we do it. But everybody else more wants to talk about that than anything else I talk about. Like, how do you manage? So, needless to say, I think that the way I describe it is sort of, when you've got wind swirling around you, maybe in the autumn when the leaves are falling, and there's just a lot of things happening in that swirl. So I think that exactly what you mentioned sociopolitically, energy and where people are. So my work is in public health practice and specifically looking at things with the strategic lens of equity. So I do a lot of racial equity work, And what I've noticed is the patterns of really just the challenge for me as a yoga teacher and bringing together my social justice and theater background into my healthcare background. It's just been really the focus of sort of almost meditating throughout the day and breathing and being there for my children and being present in the moment, but also just breathing through a lot of the challenge that has come. I've been facilitating lots of discussions around systemic racism and individual agency. And, you know, it's been tough, but I am an eternal optimist as well. I think that's kind of what bands our group together also, and just sort of focusing on silver linings and rewiring myself to focus on the positive. And it's also, I will say, you know, we used to limit our connections to being at a conference and seeing each other in person. And now, I mean, you know, we're talking virtually all the time. And so, yes, it has been tough and challenging, but also has opened up a really great opportunity for us to connect with colleagues in a regularity that just probably wasn't present before. So I'm focusing on the silver linings and really trying to see how we can, I'm all about the collective, how we can sort of amass the critical connections and critical networks and really raise the level of consciousness in this world in any sense of the word.
Thank you. We're very, very pleased that we have Elizabeth Shikalagi joining us today. And Elizabeth is the Registrar and the CEO of the Pharmacy Council of Tanzania. Elizabeth, can you tell us a little bit about your experiences over the last many months and what's happening in your part of the world and for you personally in terms of resilience? Elizabeth, you're muted. If I could ask you to unmute so that we can hear you. So just be a second.
Thank you so much for joining me in this team. I'm Elizabeth, pharmacist here in Tanzania. And of course, I'm very pleased to join you this evening. In Tanzania, we had a first case in March 16 this year. And personally, we had a sort of a panicking situation that what could we do? But I should be sincerely that since that time I've been attending work. We haven't stopped till now. What I can say about pandemic, as a regulator, the first point which I thought about was in our community pharmacies where I regulate. I was aware that people will be visiting pharmacies at the first point of care once they get some sort of symptoms of this pandemic. So what we could do, we had to, first of all, develop a guideline of do's and don'ts, because it is very risky. People here don't really visit hospital in the first place. Whenever they feel any kind of symptoms, they visit pharmacy. So my focus was, while I'm at work, thinking how can I help my fellow pharmacists so that they cannot be affected with the pandemic. So we have been going to work as usual, except for schools that were closed until end of July this year. So apart from advocacy that were provided through the ministry, we had to take all safety measures like washing our hands, but we have been attending our normal routines job, except of course, we could not travel from one point to the other. It's just in our locality, you can go to work, come back, take all the safety measure of washing hands. We stopped shaking hands for a while. Actually, until now, we don't shake hands. So it was in the panicking situation, but later on when the cases went down, it was announced that no more COVID, but people should take the precautions. So until now, we are taking precaution, but life goes as usual. We are not putting on masks. We have returned to our normal routine work. So in terms of my workplace now as the team leader of more than 50 people, I had to create a crisis management team, because at that time, when you look at the television, you get news how bad the disease is. We said, no, we have to do something. So I had to come up with a crisis management team. I gave them the terms of reference, what they should do in case anything happened at workplace, so that we can manage the situation. And as I said, nothing was closed down. So the clients keep on coming. We have to attend them, but make sure that we observe those safety measures, social distancing and all that. So now there is nothing like COVID-19 in Tanzania. If at all it's there, it is very minimal, which is not a public health threat at all. That's what I can say.
So interesting. It's one thing that strikes me from listening to all of you is what an incredibly small world it has become. Because all of us have had fairly similar struggles in terms of balancing personal and family lives with professional lives. We're perhaps at different places in terms of the pandemic spectrum. Places like New Zealand and Tanzania may be a little bit more open than places like New York or London might be. But we're all sort of in a similar situation. And that's one of the things that I hope we can explore over the course of today. And that's sort of sharing some of our experiences and insights with a global audience as a way of starting a dialogue about resilience, learning from one another, and helping us all recognize we are not alone, that all of us are struggling with different things. All of us are at different points on this continuum. And so with that, I'd like to maybe start with a first question for Dalia. And Dalia, you had mentioned in your comments that you've been doing some research that's been focused on resilience for pharmacists, patient care, et cetera. Can you share with us some highlights of the research that you've recently been doing and how you hope this research might support the profession as COVID continues to evolve and as whatever comes next happens? Dalia.
Thank you so much, Zubin. Actually, I was interested in the concept of resilience before COVID-19 hit. It was definitely sparked after I heard Karen speak about it for the first time officially in Prato 2019. And so I became really interested in finding out what resilience actually means, Zubin and dear colleagues, to different people from different cultures. Okay, and in different contexts. So what it might mean to somebody living in New York City right now might be different to somebody living perhaps in Lebanon right now, or in other places in the world. And so some of you might know that I am the majority of my research has been exploring pharmacy education and training in the Eastern Mediterranean region, the EMR. The EMR is one of WHO's 6 regions with a population of nearly 670 million people. And so I've led a project that follows on actually from a series of studies that looked at this. And whilst the majority of EMR countries share a common spoken language, being Arabic primarily, together with cultural and religious similarities, there are disparities in socioeconomic and political stability between EMR countries. And so the research that I'm involved in is a multi-phasal one, but the first phase of it is actually in data collection right now, and it is focused on exploring the factors affecting resilience amongst pharmacy students and faculty members in the Eastern Mediterranean region. That is, we're looking at cross-cultural, cross-sectional of the 22 countries of the EMR. We are hopeful that the study results will provide some evidence-based recommendations to inform all stakeholders involved in the academic world in the EMR on mechanisms, on systems, policy formation needed to enhance resilience and general well-being of students and faculty within those higher education institutions.
Dalia, can you give us, if it's possible, could you give us a little bit of a sneak preview about either some of your insights or findings, and recognizing this is research in progress, anything that you can share with our audience?
Well, it's in data collection at the moment, so the data hasn't actually yet been analyzed, but we have had quite a lot of responses so far, but we haven't actually analyzed the data. However, we are using a tool that looks at a lot of constructs of resilience, such as adaptability, for example. And so I can tell you from my own experience from working with pharmacy students in this particular region that it hasn't really been easy on them either. And the way that they have been dealing with it is perhaps unexplored. I think this is an area that hasn't really been explored in the EMR, certainly in where I have been working, Zubin. So it's something we really need to find out more about. But I can tell you that people's resilience overall in this part of the world perhaps maybe varies, because it is an area of a lot of political and economical instability.
Yeah, and this has nothing to do with COVID, as you say. Your interest in this was
and
before
COVID
the
is just
pandemic.
another layer on top of all of that.
Right.
But what I would like to acknowledge, I just would like to acknowledge that the other team members that are involved in this research, and what I'll do, Zubin, is I'll also add the link to the survey in the chat box. I must acknowledge Professor Ian Bates from UCL, who is also the lead on this project, Dr. Saja Al-Nahar from the Faculty of Pharmacy at Yarmouk University in Jordan, Dr. Muna Al-Manasef from the College of Pharmacy, King Khalid University in Saudi Arabia, and Dr. Asma Al-Haqqan, Faculty of Pharmacy, Kuwait University as well. So thank you so much for that.
Great. Sarah Willis from the University of Manchester, you've been doing some work related to resilience. Could you share with us some of your preliminary findings, or even your own personal insights in terms of what you're learning from the work that you're doing?
Thanks, Zubin. So I guess it segues quite nicely from what Dalia was saying, because we did some work last year about academic resilience, so a particular type of resilience amongst our students, and found that was not particularly great. And actually, as the course progresses, students' resilience goes down. So resilience is lower in third years than it is in first years, and in fourth years it kind of goes up a little tiny bit. But it seems to me that actually, as they progress through their education, maybe they get more setbacks, but then their resilience actually declines, and it's not until things start to go wrong that they get those opportunities to really develop those resilience kind of behaviours, because it's that adaptability, isn't it? And maybe the students, high-performing students, they've not really had too many things that have challenged them.
Can I interrupt you for a second? You use the term develop their resilience as though it's a muscle that needs to be flexed. Some people might think that resilience is more of a trait. It's like you have it or you don't. What's your take on that?
Thanks, Sue. And that's a really challenging one, isn't it? Yeah. So I'm definitely in the nurture, not nature camp, because I'm a sociologist and I'm very much about learning being a social activity rather than it being something that you're born with. So yes, I think there are probably differences in terms of, individual traits, but actually I think it's very much something that you can help, you can facilitate the development of it in your students. It's something that you don't have a set amount when you're born, and it's tough if you don't have it, because you're destined then to always experience adversity, and particularly. And so
I think that's a really important thing for us all to contemplate, that there's something that each of us can do, that if resilience is actually a muscle that can be trained, then there's opportunities for educators, for regulators, for employers to actually help people to cope, not simply write people off who aren't resilient in the first instance.
And
Very interesting.
A lot around sort of supporting people. So if you look at the research literature, it'll say, well, actually, you can put lots of support mechanisms in place for people, which will help develop their resilience. It will help them to feel less isolated, and actually therefore when things go wrong, they've got a whole range of networks and structures around them that mean that those bad things have less impact on them, because it's kind of shared amongst everybody, or there's a sense of social support. So I think, and Vibhuti probably is nodding, because I think that really draws on a lot of the work that she does.
Yep. And we'll be hopefully in this session exploring some of the opportunities for regulators and others to provide that sort of option for people. Thank you so much for sharing your work, Sarah. Let me turn it over now to Whitfield to share with us some of her research in this area and some of the takeaway lessons that she has gleaned over the last while with her work. Karen.
Oh, thanks very much, Subin. So I've been really lucky enough to be involved in a piece of research looking at hospital pharmacy workforce resilience. And this was a longitudinal study, started in July and will finish around about December. And it's a multi-site study involving 2 large hospitals, one in Victoria and one in Queensland. We're in the process of analysing the data, but there are some emerging themes coming out that I'll probably share with you. I think one of the most important things is that individual, team and organizational or system resilience, and you'll hear possibly Vibhuti and Kyle talk about this, are three very different things. And when you're considering resilience development or training, as we've just been talking about, I think we need to think about them differently and probably use different strategies to address them. So that's one thing that's coming out. The other thing that we need to consider, I think, is our leaders. Who has been looking after our leaders in COVID? So this is a really important thing that I think we need to think about. And I've really come to appreciate that resilience is a key leadership skill. And I think we must think about resilience training for our leaders and our leadership teams.
Mm-hmm. Thank you. We have a question from the audience, actually, so I'll start with Karen, but if Dahlia or Sarah would like to answer, please feel free to chime in as well. This is a question from Kay Dunkley. Is there any evidence showing that resilience in pharmacy students leads to resilience in the workplace when students graduate? Karen, Dahlia, or Sarah, anybody care to offer to try to help Kay with that question?
I think Sarah already answered it, didn't you? But
yeah, I did. So just to say that actually there's not a huge amount of longitudinal work, and that's partly just because of the cost of doing those sort of longitudinal studies. Actually, it's a massive investment to track people over time, which is a real shame, because it does sort of make sense that actually if you can develop those skills as a student in quite a safe environment, or relatively safe environment, that should have some sort of protective effects later on when you're in practice. But we have no evidence. We've only ever got cross-sectional work, I think. Dahlia, do you agree?
Yep, and the work of linking academic resilience to practitioner resilience, I don't think I've come across any work on that. But I agree, Sarah, I think it's intuitive. And when we talk to our students in the classrooms and say, look, it may get harder when you're in the practice, when you're patient facing, I think that resonates with them. So good. I agree with that.
Thank you very much. And a big thank you to Kay for launching our questions. I'd invite anybody in the audience who has any questions or observations to share with the panelists. Please use either the Q&A or the chat function, and I'll be happy to pass on your thoughts to the panelists. As you've already heard from our panelists so far, there's been lots of work going on in the area of resilience research. But of course, for many people listening today, there's a real interest in knowing what kind of supports are available. What kind of continuing professional development is currently available, is projected to be available. And so with that, I'm going to ask Katrina, speaking from the Irish Institute of Pharmacy perspective, to share with us some of the work that she and her organization have been doing to provide the profession with supports to get through not just COVID, but whatever else comes our way. Katrina?
Take myself off mute. Thanks, Zubin. Yeah, when we started, so the Irish Institute of Pharmacy is in a quite lucky position. We have very close connections with the regulator. We're appointed by the regulator and work on their behalf in providing and supporting continuing professional development for the pharmacy profession across all sectors. We're also based in the University of RCSI, so we have a lot of connections academically, and we also work very closely with pharmacists. So the first thing we did is we went out to the profession and said, tell us, we've a group of peer support pharmacists who allow this two-way dialogue, and they were in existence way before COVID, and they were really helpful. They said, we need information first and foremost at the very beginning of this. We need some information on how we can keep this up. We're stressed and we need resilience. We need to think about our mental health, and we need connection. And we already had started working with mentoring programs, and they said, those mentoring skills are really, really helpful, and we want more mentoring and connection and support. The regulator needed support on all of those issues, but also on return to practice, because we suddenly opened up a return to practice Section 77 process. So what we did in the very beginning was provide materials and information where it was needed. So we developed the brilliant team in the Institute of Pharmacy, and this was led specifically by Alicia O'Dwyer. She developed the COVID hub with lots of stakeholders, which was an area where all the information from the health service, from the profession, from the regulator were in one place for hospital and community colleagues. And we had great support from our colleagues in almost crowdsourcing that information. So pharmacists in one hospital were discovering certain drug regimens, and they wanted to share their protocols with everybody else. So we had one place. We also developed the COVID return to practice. But one of the most interesting things that we did that has really taken off is our webinar series. So I genuinely, as a leader, would have thought the last thing our colleagues need is a set of webinars, and surely they will tell us to go jump if we start saying, why don't you join us in the evening after your really busy day? But actually, we've had, consistently between 200 and 400 people on these webinars every fortnight. And we've tackled all, they drive the content, and we get the people in who are relevant, and it talks about issues of, reduce your stress curve was one of the first things we addressed. Professor Abby Lane, a consultant psychiatrist, came on, and we had people who were working in the health service at infection prevention and control. And we talked about the new electronic transmission of prescriptions, and they have been really popular, both because we're giving information that's relevant in a timely fashion, but also because of the connection. And the last thing I would say is we've done a very informal survey, a needs analysis on mental health and well-being. And this is from a COVID working group. The working group is chaired by Kate Mulvena, and the mental health working group is by a lady called Kieran Dooling. And this has been fantastic. And we put 4 or 5 questions out to the profession. What's causing you stress? How are you dealing it? What do you need? And what are your current stress levels? Their stress levels were very, very high. We had about 370 people respond. Now that's only 6 or 7% of the register, so it's a very small sample, but it's congruent with what people anecdotally are telling us. 1, pharmacists are very stressed by their workload. It's all the extra administration, the PPE, the distancing, irate customers being on the front line, the GPs being closed. That's in community, and in hospital likewise.
And sorry to interrupt you, Katrina, but this predates COVID, I'm sure. This sort of workload, the stress. Yeah.
This is the thing. We asked, what do you do to alleviate your stress? And they said, the big thing was exercise, running, jogging, meditation, evaluation, linking with friends. And so you had this predominant stress is being caused in work. And often, as you say, Zubin, many of these things predate COVID. The way in which pharmacists have been dealing with that is trying to increase their personal resilience. And actually, I think where we're getting to is something that you found in your own studies, that the environment actually in which you're working, you can be a very resilient person, but if you're in a very difficult working environment, that's tough. And you can be not particularly resilient, but if you have a supportive team and a supportive employer, you'll be fine. And I think where we're going to have to look at working is with systems and employers and system issues. And I have to say the Health Service and the Department of Health and the unions and all the regulator are all very invested in doing this. But what I would say is, as pharmacists, yes, we need to manage our control and our stress, but we also need to manage our environment. And so I think our focus will be on enhancing influencing skills, work process management, lean processes, and those. So I think resilience, it's almost like when somebody tells you how to raise a child. Everybody has an opinion, but nobody knows your child. And I think resilience is like that. You need to know, what do I need? And it may be well-being, it may be meditation, it may be yoga, or it may be assertiveness or decision making or lean processes, but you need to know yourself, and that self-awareness. So I think that's, the Institute has always been involved in self-awareness, enablement, coaching. We're continuing to do it, but we're only able to do it because the profession tell us what they need, and the Institute staff have been incredibly flexible. We've changed our operating model so much. So that would be my takeaway point. How you manage your resilience is how you manage your children.
Okay, we have a question from the audience. This is from Ahmed Kashiba, who asks, is there any collaboration with physicians that you've sort of embedded in any of your programming, any of your work, focused specifically on maybe interprofessional issues with respect to resilience, Katrina?
Oh, me. Yes. So we've had a number of our webinars, and the ones that were popular is where we had our GP colleagues with us as well. So when it came to transmission of prescriptions, having the GP and pharmacist interface was so important, because GPs suddenly were transmitting their prescriptions by electronic means, which hadn't happened before, and pharmacists were getting them. Neither knew what the other interface looked like, and actually both were having real frustrations. And having that an interprofessional approach to it, this is our new way of working, actually was really useful. We've also done that in the area of drug misuse. So we had a wonderful presenter who was talking to us about the increase, the decrease abuse of heroin because the poppy fields, because of social distancing, poppies couldn't be harvested. Who knew? And so benzodiazepine abuse is actually increasing. So the relationships and the interactions we've had with our GPs and with other colleagues and nurses as well has actually been starting to improve. And I don't want to go back to the old way of working, and I don't think our colleagues do either. So we've seen more interprofessional working, but we've seen some places where we could have done it better. And I think particularly where the GPs and the pharmacists in the community, that's been difficult because of all the restrictions.
Good, thank you. At this point, I'd like to actually introduce our another speaker on our panel, and that is Catherine Duggan, who, of course, is the CEO of FIP. And Catherine, I'd like to get you to weigh in a little bit, perhaps, in terms of FIP's role. You know, clearly you're investing in webinars such as this to support resilience and a conversation around resilience within the profession. What would you share in terms of FIP's approach and the sorts of things that FIP is able to offer pharmacists, employers, regulators in the area of resilience?
Thank you, Zubin. Firstly, thanks a million for inviting me to the panel today. I've just been blown away by the conversations I've been listening to. And I did love your trip up there about the UK Brexit and global resistance. It feels sometimes like our countries are in a little bit of a standoff moment. But thank you so much, Zubin. So I just reflect before I get on to what we can do for everyone. We started 2020 FIP with a very grand plan for the year with 2 big global congresses, one plan for Canada and one plan for Seville. We were really motoring with our regional engagement because we've committed to the Astana Declaration and we really want to mobilise all sectors of our profession to deliver. So we had conferences planned in Bali and in Mombasa, and we had summits here, there and everywhere. And this was all being signed off in February. And we were all ahead with our plans for reports and everything. And then suddenly, screeching halt. I was in Geneva beginning of March. And then I think my last flight back from the Netherlands to London was March the 12th. And I just resonate with everybody's experiences on this. So I was thinking about, resilience, and that normally we think of resilient people as being strong and tough and able to withstand and powerful. And yet there's a very different definition, which is really about being elasticity. And engineers know this fully, that the more rigid you make a structure, the more brittle and fragile it is. The more elastic you make a structure, the more it's able to withstand the batterings. So on a personal level, I'm listening, and you really need to offer people the opportunity to understand their strengths and flexibility and where things have gone well. And that's something I think FIP can do. We've got a big professional role to do, but the individual piece is where I think we've really found an opportunity. And when we did our virtual conference, like our global congress over a virtual platform over a 3-week period, some of the conversations, Zubin, some of the interactions, some of the insights that were shared, I think were more intimate than they ever would have been if we'd have been in a room. I was really taken aback. Some of the guys who are on the call today were involved with some of that, but it just really, really made me humble to think that people were able to use a digital platform to share. And that isn't about it being a digital, is it? It's about offering people a platform. So that's what we've been doing. We realized that everything that we had planned for this year was about engagement, getting commitment, getting action, driving through some change into 2021. And then we realized very speedily that we had to do all of that ourselves at FIP in order to enable others to do that. So we took a deep breath, and the team has basically worked. They've delivered the whole business plan, but also on top of that, all of the digital program. But one of the reasons why we've done that, Zubin, is because every single sector in our profession has been working their fingers to the bone. Our frontline pharmacists, never before has community pharmacy been so visible in all our communities globally. The things that community pharmacies have done and delivered, and the pharmacists and their teams. Hospital the same, academia the same, industry the same. So it fills you with this almost like more petrol in your engine, more diesel in your engine, more electricity in your engine to really power through doing some of this. And shining a light on others is such a brilliant way to think about what FIP can do best. Showcasing everything on our website, it's all publicly available, not just member only, has really driven people to membership, but also really allowed us to do what organisations like FIP should do. It's not about us. It's not about shining a light on ourselves. It's about shining a light on the others. And when you do that, you get the reflective light back. And that is something that we've learned tenfold. So we have got very clear advocacy, leadership, regulatory opportunities for the member organisations. But for individual organisations, we have provided that platform for people to share, inspire, sob, engage, interact.
Yeah, and I think that's such an important common theme that we're hearing across all of our speakers, that need to connect, that need to hear from others, that need to feel less isolated. And that's where FIP's global leadership and global reach is absolutely pivotal. So thank you so much for sharing those thoughts, Catherine. There's a question from Dr. Sham Moodley. I'll ask Elizabeth, perhaps, if she could comment on this. This is Dr. Moodley's comment. Pharmacy students in Africa, and actually anywhere in the world, come in their own level of resilience because of their tough schooling environment. As Sarah Willis pointed out, you learn a little bit about becoming resilient simply by completing a demanding pharmacy program. Universities try to be supportive. Dr. Moodley is wondering what impact the practice environment has, internship, community service, etc., and sort of what's been happening perhaps in your experience, Elizabeth, in terms of students and what the impact of COVID has been on them getting jobs or placements, and how all of this impacts on them during their studies. What's your observation been from your context, Elizabeth? If I could just ask you to unmute.
Thank you very much for the question. As I said, for us here, even in placements in the hospitals, because as the country, we had to select one hospital where the COVID cases were being managed. And therefore, all intern pharmacists were taken out of that center, except few, at least to minimize the risk which was around. So the tension mainly was focused to medical doctors and nurses who were in front line to make sure that they manage these cases. But for intern pharmacists, not that much. So they were taken away and being placed to some other centers. And when the pandemic, where cases went down, that center was closed and they all returned back to their normal placement area. So it wasn't, for us, it wasn't that much serious. So I cannot comment more on the students, but it's true that they are facing difficulties during their studies, so they can persist any kind of difficulties they get. Yes, I agree with that. But for this particular pandemic duration, there was no such challenges for us.
Okay, thank you, Elizabeth. We have a specific question from for Kyle Wilby. I'm very much interested in hearing from Kyle regarding the New Zealand experience of the numerous transitions from face-to-face to hybrid blended learning and back and forth again. Any thoughts for colleagues across the globe on what helped students, faculty, and staff? This sort of brings us more into some of the curricular adaptations that we have seen and what we can learn about resilience from that perspective. Kyle.
Thanks, Zubin, and thanks, Di, for asking the question. Yeah, it's been quite the process here in New Zealand where even though we haven't had COVID for a while, we've definitely been through different levels and have had to go from strictly online to it was in person, and then back to online, and then a hybrid where some was online, some was in person, and then finally we ended in person. And really, and Vibhuti and I have said a few things here in the chat, I think to all attendees, what's really helped us, and I think what the success was from the New Zealand perspective, was about being ready. So shifting that conversation from how do students, staff, how are they resilient to? How can we make people be ready? How can we say, okay, in 2 days, I'm going to take this from Vibuti specifically, but in 48 hours, you have to go online. What do you need in order to do that? How much training do you need? How many online events do we need to have in order to make that happen? And also clear messaging. So for the New Zealand strategy, the government was very well messaged in terms of at level 1, it means this, level 2 means this, all the way to level 4. And the university created a strategy around that. So for instance, when we went to level 2, okay, we're hybrid. This is the teaching events that are going to be in person versus these are the ones that are going to be online. Students knew that, staff knew that, and it was all about clear messaging. And I think that was really a key point for us to help students and staff transition through these different periods. In my experience here, I found that when messaging gets a little bit foggy, where people aren't really sure of what's happening, that depletes their resilience, because then we have some extra stress and anxiety about what's happening. So really it's up to that leadership team to really make that system ready and to message that clearly back to your stakeholders.
Great, thank you for that, Kyle. Let's continue on this undergraduate professional curricular type of approach. Sarah Willis, what are some of the things that have been happening at the University of Manchester around helping students to develop, adapt, as Catherine so eloquently put it, demonstrate flexibility, not just rigidity in terms of dealing with things? What have you been doing and your colleagues at the University of Manchester?
Oh, without wanting to be too negative about what's happened at Manchester, it really resonates with what Kyle said, but it's kind of been the opposite. So I think there hasn't been particularly clear messaging. The students have felt very confused. Part of that, it has been reactive necessarily, because we have moved from so many different tiers to different statuses between what's happening in different parts of the country. So it has been quite difficult, but I think personally I'm very concerned about some of my students who seem to be incredibly isolated, maybe living at home with shielding family members who are really struggling. They're struggling with their own mental health, they're struggling with being worried about their family, they may be struggling with keeping up with online learning, they may not have a space to study at home because they live in a family home with lots of siblings. There may not be anywhere for them to work. So actually, we've tried to put in lots of extra support for those students, but some of them recognizing that some don't always know that they're not doing very well. So some of them don't have that capacity to be able to reflect and identify their own kind of learning needs and where they need support. But also there's a real reluctance, and without really stereotyping, I think some of our boy students, some of the men may find it harder to reach out and say, I'm struggling with online learning, I don't know who to turn to, I'm feeling unable to cope with the situation, because there's quite a sort of, they're only young men, and there's quite I know it sounds terrible, isn't it? I'm such a stereotype, but I just reflecting on a conversation that I had with a young man yesterday who very much felt unable to cope, but didn't know that he was not coping.
I think that's an important lesson for all of us, that we sometimes think that students are digital natives. This online learning stuff comes naturally and easy for them. But it's beyond just knowing how to use a computer, that ability to connect, to engage, to be with others, to not feel the weight of the world on your shoulders. It's very easy for us to forget that students may be much more vulnerable than we think they are. Dahlia, in your part of the world, what are you seeing from an undergraduate professional perspective? Are there any innovations that your program or programs in your region have been doing to help support students and to enhance resilience or readiness, not just for COVID, but for the time when COVID is ended and other stresses will occur?
Thank you, Zubin. Again, I'd like to reiterate that I think this concept is very underexplored, Zubin. In this part of the world, and that's why I'm very passionate about trying to pursue its exploration. So I think there's a lot of disparity where different countries and where different academic institutions are with regard to this particular concept. Overall, Zubin and everyone, our students struggle with online learning, just like anywhere else. And we struggle with them because a lot of the times our students don't even put their cameras on. And so we even don't have that face-to-face. I mean, even though now we're talking, via a digital video, but the fact that we're seeing each other makes a difference to how it all feels. So we're struggling with the simple things, like just asking them to put their videos on. So back in April, just straight after our lockdown, I actually started a little project. I actually called it Online Coffee Break for students, where I just wanted the students to come together via a Zoom call, and with the aid of the Student Affairs Department, and I also had on board the social counselor as well, we curated a few topics, some of which revolved around time management, coping strategies, a little bit on resilience. Again, providing that safe environment for students to really share their thoughts, their fears, their concerns. A lot of these students had been in lockdown under curfew conditions for months. So needless to say, giving them that safe environment and actually also sharing that we're struggling. That we're not superheroes.
Again, going back to Catherine Duggan's comment about flexibility and engagement, giving people an opportunity to connect with one another. That's a very important theme I'm hearing across things. Could I ask you, Dahlia, this is a question from Nicola Cantwell, for Dahlia as well as for anybody else. Are you doing any extra assessments for students who may have learning difficulties? For example, online learning may not automatically be suitable for a student who may have dyslexia, or other kinds of learning related issues?
That's actually a really, really good question, because I have come across a particular student with a learning disability by coincidence, and that is something that's actually being dealt with at the moment. This is really tough. We don't have experience in this, but it is definitely an area that needs exploration and a lot of involvement from the admin as well, and leadership. Yeah.
Thank you.
Thank you for the question.
Let me ask Vibhuti a question. This is an unscripted question, Vibhuti, that comes to us from Kay Dunkley. Kay asks, an emphasis on individual resilience versus group and organizational resilience can lead to a lack of individual resilience being used as a criticism. For example, someone saying, you are not resilient enough for this job or this role. Maybe being a pharmacist isn't right for you. Do you have any comments as to how to avoid the term resilience being used as a weapon, being used to judge individuals if they show vulnerability?
So yes, I think that humans are, please pardon my candidness, but we're idiots in a lot of sense, in that we subscribe to these fad diets, right? Like, I've been doing racial equity work, racism and structural racism has become a thing. Health equity has become a thing. Resilience has become a thing. And so I think that there is a sense of, we just have to observe the spectrum, right? Because there is a sense of checklisting behavior and things that come with all of this. So there's like, oh, we want to be resilient, so let's all sit around and talk about this and, focus on all of this. We just have to look at the spectrum and understanding that these terms, the evolution, these concepts are there to build community and to build the collective and to raise, rather than just blame people or say, or use it, as you said, as a weapon or a criticism. I think we have to be really careful. And I will put that on all of us too, because the way that we phrase resilience, the way that we talk about it, in my world, we talk a lot about, so there's a couple of concepts. One is the individual, right? We tend to put it all on the individual and absolve ourselves, that as though we don't participate in a system that actually perpetuates not resilience, whatever that the opposite is, the antonym, right? Because I think that it's the same thing with patient care or our students. We say it's the student's responsibility, it's the patient's responsibility to eat better, exercise better, et cetera, without really how that actually either nurtures or hinders their progress and performance. In my work, I facilitate discussions that look at systems and structures, not as a mechanical thing like gears of a clock, but really as like a beehive and a dynamism to it. We all participate in that system, and the way that we all perform and behave in that system contributes to the norms and the mental models and the way that that system behaves as a thing. And so I think that it's not just up to the individuals. It's not just a person being resilient. It's all about our response to our environment, right? It is how some of us handle adversity. The way I've grown up, we look around and especially when it comes to communities of color and marginalized communities, there's a privilege in sitting here and talking about resilience. There's a privilege in self-awareness. There's a complete privilege in reflection and being able to have a sip of coffee and say, how has this year changed me, versus survival and go, 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 and not having a moment and an opportunity. You know, I hear Dahlia talking about the EMR, the region, about resilience, and there's again, a privilege, right? Because people look at communities that all of us kind of sit around and talk about privilege, talk about resilience in such a privileged manner, and say like, that really being vulnerable to you and you want a cookie for that, you know, versus their communities who are dealing with their kids maybe not returning home, right? From living in a war-torn environment, from experiencing racism and coming up. There's a lot of resilience collectively that communities have shown that we just don't call resilience or have not called it. And so I think that I just want to bring that perspective, because I do think that we can't just put it on the individual. We have to take ownership and being part of that collective, but also recognizing that there's a privilege in discussing things in such an academic manner. And to what I hear sort of Dahlia also saying is to bring up these narratives, right, that have sort of not been part of that discussion. So I do think that it's important for us to put resilience in the context and also recognize and observe how we use it to promote rather than hold people responsible or judge people. And so that's all, yeah, I'll leave it at that.
No, thank you so much. A really, really insightful response to that. I'd like to ask Katrina to comment on this question as well too. How do we prevent the term resilience or the concept of resilience being used as a weapon to judge individuals who show vulnerability?
I just think it's almost like what Vibhuti said earlier, Vibhuti, how long do we have? Because that is such a phenomenal question. There's two things I would say. We can't victimize the individual for showing vulnerability. At the same time, it happens. But I also think we can't just blame a system, because we are the system and people are the system. And so at the end of the day, it comes back to individual action. And I know I've worked within the same system with two different managers, and one manager almost crushed me. Really brought me to a very kind of depleted my resilience. And another has absolutely, Mary Rose Burke, I'll out her now, she was my line manager and remains a close friend. She recognized that I wasn't great with ambiguity and change, and we've acknowledged here how important that is. So she would deliberately put me into ambiguous situations and let me sink or swim, knowing that she was on the pool side if I really struggled, but putting me and developing me in situations. So that, I think people are the core, first of all, and our leaders and our cultures are all about collective action. So that's one thing. And as a leader, I feel a real responsibility to bring this person-centered approach to how we deal with everything. The other thing I would like to say, and it seems almost like the antithesis of what I've said, is that we are pharmacists, and we have to acknowledge that the very action of being a pharmacist means that we are very precise, very structure focused, very good at we're very good at perfection. And I used to say to pharmacists and to pharmacists and to students, perfection is required in dispensing and in your clinical work, but it's not required in life. And I think we're so good, and any weakness is an overexpression of a strength. And therefore, I think sometimes as a pharmacist, we're trained, and certainly I was, it may not still be the case, but we're trained to be so scientifically rigorous and use the evidence, that then moving to intuition and adaptability and flexibility, I just wonder where we learn that. And for me, it's through people. And so I think we all have a collective responsibility.
Thank you. I'd like to ask Catherine Duggan this question, not so much from her perch as CEO of FIP, but as a person who has had a wide variety of different career opportunities, career trajectories. I'm not sure if anybody has ever said to you, Catherine, you're not resilient enough for this job. But if I ask you just to reflect on your own, recognizing that reflection is a privilege, as Vibhuti reminded us, but reflect on your own experiences with this and the variety of different roles that you've had, many of which have been extraordinarily demanding and challenging positions.
Well, Zubin, what a privilege this is. And I really take that on the chin, Vibhuti. I'm the first female CEO of the Federation. but remember that I am white, Northern European woman. So I might be a female in the role, but I don't represent all females, and I need to, definitely be aware of that. It's very interesting, isn't it, Zubin, how we talk about resilience, and I put this in the chat, resilience and coping as being good, and perhaps vulnerability or senses of failure as being bad. And we're all on a spectrum of all of these all the time. I've had some really big challenges, actually, Zubin, and I think there's an opportunity for us to perhaps explore this subsequently, because we don't often admit this. We don't often admit when we've had a challenging time, or when we found a situation we've been in very challenging and it has maybe undermined us or made us feel vulnerable. I would say that some of my early learned traits, like my need to please, my need to be seen as super smart, my need to, do everything that I'm asked of, perhaps, as Katrina said, came in as a bit of a force of nature, and I overcompensated in situations when I could have just taken a breath and said, can I just check what you really need from me? Or no, that's not my job, perhaps a little bit more. But the one thing I would say is that you need to surround yourself with a network of not like-minded people, but people who get you. And that's a very different thing. And I think for a while I had a lot of like-minded people around me. And then I never got the bit of a challenge of, well, you know what, CD, perhaps if you did this like this. My top tip would be that this time has given me an opportunity to think not in terms of black and white. Have you heard the phrase this year of the Corona coaster? So week by week, you can feel up, down, flat. A little bit flat, I think, is a really good phrase. And on those days, think about what you have done and what you have done well, rather than what you haven't. Purposefully do that, purposefully doing that, and perhaps even doing that as you're working your way through different jobs and roles is a really good thing. And seeking some feedback as you go as well, Zubin. But right. I'd be happy to, but you know what, just for once, it's not all about me.
No, but thank you for sharing your experience, as I say, as a very public figure in the pharmacy world globally, for you to share that level of, like that. It may not be as easy as it looks.
No, never is. It never is, Zubin. Yeah.
Alicia Penabizama has said, Catherine, a good point. Resilience is not the absence of vulnerability, but being aware of what we need. And as you say, making contact with our support network is absolutely essential to that. So thank you for sharing that comment. I'd like to go a little bit back further in the chat to a comment that Kyle had made in response to something Katrina said. And that was Katrina's comment about a person-centered approach. And Kyle had commented that that's a really key issue. So Kyle, could I ask you briefly to comment on what you were thinking, or what for you a person-centered approach is with respect to resilience, and what you as an educator do to actually help implement that in your work?
Thanks, Zubin. And yeah, Katrina, and I think Vibhuti as well had mentioned in the chat previously too. For me, it's, again, I'm an administrator, so it's all about designing educational programs with students and staff. And I think sometimes in leadership positions and in management, we can get a bit too focused on the system, even though I talk a lot about systems, and really it's that end user at the end of the day that we do need to focus on. And so when Katrina had talked about, person-centered approach to designing programming in the space, I think that we can't undervalue that at all. Really, in my experience coming through this in New Zealand, back to the point of kind of going back through different aspects of in-person, online, hybrid, all that kind of teaching, you have to think of that user. What's going to make it easy for them to adapt? What's going to, so I have a bit of a cat issue at the moment. What's going to zoom office space, here we are. But again, what's going to make it for the student that's going to be easy to adapt, what's going to make it for the staff member, and then not just say in general. So your near retirement staff member who's never used Zoom before, what do you need to do for them versus say, someone who's a bit more technologically inclined, and really work towards people's strengths and identify areas that you can work to adapting any sort of system-based programming towards them. So again, not forgetting who that end user is and really trying to focus as leadership on them as you progress through your training or development strategies.
Thank you, Kyle. Now, there's an interesting conversation that has started to erupt on our chat function. It was started with a comment from Carly Johns that said, vulnerability requires an environment where one feels psychologically safe. To which Kay Dunkley responded, so true, Carly, and unfortunately there are not enough psychologically safe environments in pharmacy. I'm going to ask our resident sociologist, Sarah Willis, perhaps, if she could reflect a little bit on what does that mean? What from your perspective is psychological safety, and what does it look like in pharmacy, and why would many of us agree with Kay's comment that there just aren't enough of these environments in pharmacy? Sarah.
Oh, you give me all the tough questions. Thanks. Psychological, I suppose I wouldn't want to make a generalization and say that all environments are the same, because I'm a sociologist and I'm going to say that. So I think some of the things that colleagues have said around thinking about what happened, not just in the UK, but internationally when the COVID pandemic first started, and in the UK where the GP practice closed their doors, but this didn't just happen in the UK, and suddenly community pharmacy became this really high pressure, more high pressurized environment and the only accessible open source of patient care. I think that became a very pressurized environment, and actually that I would probably say is not psychologically a very safe environment, but there were things that could happen that could make people feel slightly safer. Really easy things like giving people closing for lunch. That made a big difference to people. Just being able to say, no, the pharmacy's closed now, and while there's a massive queue of 200 people outside, it's really important to have a safe space and space to recover. So I think that was a really key thing in hospital pharmacy. A lot of the stuff, and again, what people have been saying was around clear messaging from managers. Nobody knew what was going to happen, but actually having a sense that somebody had your back, or that somebody was going to let you know and will be clear and consistent in what they tell you, so that actually it felt like it was safe. But I think some of the sad things that some of the interesting things that have come out of some work that I've been doing with colleagues in the UK that really built on the work that Karen did. So we used some of the same measures that Karen had used in Australia, thinking about what support needs pharmacists needed. And loads of them talked about having space to go and have their dinner, lunch, whatever we might call it in different parts of it. So just having somewhere where you can get away from clients, where you can get away from patients, where you can be with your colleagues and just de-stress, because otherwise you carry that around with you. And it had that real knockover and transfer effect. So then pharmacists going home and feeling they couldn't say, I've had a really tough day at work, because they've got to support people in their work environment, going home and their family saying, I'm really worried about you. You're working in a really dangerous environment. You're coming into contact with sick people. And so having to reassure the families as well. So there's no let up. So that's safety. There was not a safety valve, if you like, at home or at work.
Mm-hmm. Thank you. I'd like to ask Karen, actually, some of your work is focused actually on this notion of safety, psychological and otherwise. What sort of insights do you have in terms of the answer to the question of psychological safety in pharmacy?
I might just take it down a different route, but it is related. So I do a lot of work around building really effective, highly functioning teams. And what I'm starting to think now is that we need to really build highly effective, resilient teams. And this is all to do with building trust within your team, and it comes back to vulnerability. If you are going to express vulnerability and say that perhaps you're not coping or today or you're not okay today, you need a really supportive team around you. And I think building teams that trust each other does not come overnight. It takes months, sometimes years, to build that team around you. But when you do that really, really well, the results are fantastic. And I think now we need to look at building highly effective but resilient teams. And that might answer some of this question.
Great, thank you for that insight. Catherine Duggan, you had an interesting comment in the chat function, and you talk about how I think you can feel vulnerable in unsafe environments, and that in itself can make you feel extremely pressurized and stressed. You cannot show vulnerability no matter how much you feel it. Do you have any suggestions? And many pharmacists will see that comment and say, that's exactly where I work. Catherine, do you have any thoughts or suggestions on what can somebody do in that kind of a situation when you feel you are in an unsafe environment? And any thoughts or insights that you might be able to share?
So perhaps something that I've learnt in recent years is that you don't need to have all the tools in your toolbox right at the very beginning. You can seek some support, or you can get some coaching specifically for difficult situations. And I have to say, I think it's a bit revolutionary when you give somebody the opportunity to say, have you thought about seeking some absolute active help, targeted help to help you through that situation? Because most times when you're really, really vulnerable, you feel like you've painted into a corner. That can be in any environment. So if you invest in a little bit of coaching, not just mentoring, but active coaching about how to address a situation in a workplace in a way that won't then cause you to get more blame and more castigation, is a really powerful tool for your toolkit. And I think also, Zubin, some things that we don't always consider is an investment like that can help you with all sorts of relationships and all sorts of other interactions that you may have along the way. And I think it comes to Karen's point, which is, if you're seeking to be part of a highly effective team in your mind, you'd like that, then coaching helps you get there. If you're part of a highly destructive team, coaching will help you get out. And it's something that, when you look back at yourself 20, 30 years ago and think, things I wish I'd have given myself the permission to have asked for some proper help at different times. I'm good at asking for help and advice, but I mean that active thing without thinking I had to have all the answers at the very beginning, which comes to Katrina's point, which is we're pharmacists. We have to have all the answers, and it's our fault if we don't. We blame ourselves for the vulnerability.
Thank you for that. So a couple of other comments. I'd like to ask Vibhuti to comment on this. And I'm going to turn it over to Dahlia following Vibhuti's comment. Vibhuti.
Yeah, I just wanted to make a quick sort of comment about the agency that we all have, right? So sometimes in those environments, and Katrina, I've had an experience like you where it's the same environment, two very different leaders, and one leads to burnout, one leads to thriving, right? And just like in mind-body medicine, I teach about, resilience, and also allostatic load. Remember that? Like, we get repeated hits of stimulus. And if you don't develop a coping mechanism, you either, you're constantly in the fight or flight burnout mode, right? That's what it's going to lead to. But as an individual, it's also really important to take a step back and understand that sometimes the environment is not going to be right for you. And that's okay as well. I think that we have developed a culture around, we can't give up, we can't fail, we have to have the answers, and all of that we're talking about, right? We also talk about our failures very quickly to the happy ending part, right? We went through this and here's what happened. We need to spend a little bit more time in how that made us feel, because that's where the connection lies in all of the other individuals. And that's where you get the conversation like, oh yeah, I remember that. So I think that there is an individual agency that we have. And what I'd like to offer is maybe two questions we can ask ourselves anytime we're dealing with resilience and where we are. One is, what's within my own sphere of influence and control, right? Because all we can really do is control our own efforts, right? That's where the individual sort of strength lies. The other is, how am I also contributing to the system? And perhaps that's the way that we start understanding, I have individual agency, and then how do I use my privilege to actually improve or impact the system however I am? And those questions are really reflective in helping us figure out our own next steps as well.
Thank you. Very interesting comment. I'd like to turn it over now to Dahlia, who points out that perhaps this whole conversation that we are having has more than just a whiff of privilege to it. And certainly from her perspective, we need to offer support to colleagues who may not have the kind of opportunities to express vulnerability that perhaps some of us have enjoyed. Dahlia, could I ask you to expand a bit on that and to discuss what you're thinking?
Thank you, Zubin. So what I'm thinking, again, I'm actually thinking of our colleagues, of our students, of our friends who don't get the opportunity to have such very important conversations. So going back to one of the comments about how do you deal with, for example, individuals that think resilience is all about coping and never giving up, and it's never about being weak. How do we give them the opportunity to express vulnerability and feel safe at the same time? So my mind goes to our colleagues in Lebanon who had to endure not only the current financial and political unrest, plus the COVID, but also the August the 4th Beirut port blast. And I just wanted to point out that this is an area that I'm also involved in now. We're actually looking at how community pharmacists in Lebanon have responded after the Beirut port blast. Again, it's a different field, isn't it? It's a different ball game. We're going to be talking, we have already started talking to people, and I'm working with people from Sydney and from Lebanon who are leading this kind of work. Again, it is a totally different conversation. While here we're talking about allowing people to talk about vulnerability and self-reflection and self-awareness, there are people who are just trying to make ends meet on a daily basis, and to be just safe and provide for their families. And these are our fellow practitioners, fellow pharmacists, colleagues that we deal with probably very often. And so that's my point, Zoe, that's my comment to that.
Thank you so much for sharing that really important insight. I'd like to ask Katrina to maybe expand a little bit on a comment that she had made earlier in the chat, and that is about a recent development in Ireland. Her colleague Sarah Chambers is working on developing sort of a profession-wide program. Could I maybe ask you to speak a little bit about that for those who might be interested in accessing it, or for colleagues in other parts of the world who might be looking at developing similar kinds of programs in their jurisdictions? Katrina.
Yeah, thanks, Zubin. I think this builds nicely on what we've just been talking about, and also some of the comments in the comment box, which is how do we build these skills from in early career? Because you can't pack everything into an undergraduate syllabus. We can't make people be managers, and some of that evolves. And therefore, mentoring we've identified as being really important. And we started by just providing mentorship skills training, and people said they really enjoyed it. We tried to look for a mentoring program, and normally they focus on one organization or one place of work. Doing it across the profession was going to be tough. So Sarah has been leading a project where we're working with EMC, the European Mentoring and Coaching Council, EMCC, sorry, I always get it wrong. We're getting an accredited program where we have a really robust process. You need to support your mentees and mentors. You need to train people on how to receive feedback as well as provide feedback. You need to have the right matching processes. You need to know the intent of it, because sometimes you can start mentoring programs and then they peter out. So there's a lot of work in it, and we're at the early stages. Happy to speak to anybody about that initial, but we've got the accredited program now, and we need to start the implementation and pilot. So certainly happy to come back at some stage, but I don't think you can just take an off-the-shelf, let's do mentoring. There's a lot involved to do it properly, and making sure you can do more harm than good with the intention of doing good, and that's what we feel. So yeah, we're taking it slowly, but I'm really excited about it. I think it's going to be a game changer.
Thank you so much for that. In the remaining 7 or 8 minutes we have, what I'm going to do is ask each of the panelists to reflect on our conversation, distill their personal work in this area, whether it's in education or research, and just think about one piece of advice that each of you as panelists might want to offer the pharmacists and others listening in on this session, how to best remain resilient in these difficult times and in the face of whatever is going to come next. Based on sort of everything we've talked about and you have done as an individual, what is your best advice to everybody listening in terms of how to remain resilient, whatever may come? With that, let me perhaps start with you, Katrina.
Sure, thanks, Zubin. No, but seriously, I would build on some of the things that people have said, and one that Catherine specifically. I think from a webinar like this, you need one action that you can take away. And my one action to people would be find a critical friend. So that's a person who understands you and gets you, but will be able to also show you where maybe some of your blind spots are. And that can sometimes be a coach. Because they can be good like that, but you may not need to go to coaching, just somebody who will actually help hold up the mirror to you and help you become more self-aware. And I think resilience starts with self-awareness.
Thank you, Katrina. Elizabeth, perhaps I could ask you, based on your experience, what's the one piece of advice you would give to people listening today in terms of what they can do to maintain or enhance their resilience?
Thank you. As Katrina has just said, we need to, first of all, we need to be connected. And of course, I would say that I have not done justice to Katrina because I have learned a lot of things through Irish Institute of Pharmacy. It's a long story, but what I can say, the practice of pharmacists in Tanzania now has been evolved from what I have learned from Katrina and his team. They did a very good job. So through connecting, we can make things happening. And of course, as pharmacists, I know we do face a number of challenges, especially in the healthcare team, but we have to stand still and understand that we are very potential. We are very potential, so we have to be confident in whatever we are doing. Unfortunately, we don't have time, but for us here, since this pandemic came, we realized that, so some of the things pharmacists can do, for example, for the hand sanitizer, now pharmacists here, we made it. We used to make it locally since the pandemic started. So people have to identify and see what potential do we have in us and what contribution can we bring at the end of the day. So connecting, I trust that can make us really move from where we are. Thank you
so much. Thank you for that. Vibhuti, let me ask you that question. What's your one takeaway or your one piece of advice for those listening?
I think for those who have the privilege, getting some time for self-awareness is important. I go back to the two things. So we're part of a system, and it's important to understand how we function in that system and how we perform and behave in that system. So I would just offer two questions for awareness, which is, how am I responding to when I get vulnerable? What happens there, right? Do I act like a toddler throwing a tantrum, or do I actually own up? So I think that's where the critical connections come in. So self-awareness, but also how am I participating in the system?
Thank you. Dahlia, let me turn it over to you.
Thank you, Zubin. In addition to what everybody else have said, something I share with my daughters actually, and also my students and my close friends, and that is the question of gratitude. Embracing gratitude is extremely humbling for me, being really thankful for what we have. Communication is key, especially during these unprecedented times. And kindness, that's my third one. Kindness to ourselves, so self-compassion and kindness to other people must be also a remedy to try and weather these current crises and emerge more resilient as well. Thank you so much, Zubin.
Thank you. Karen, what's your thoughts on this?
I love everything that's been said so far. I totally agree with it. So I am going to throw out a piece of advice about really thinking about how you develop your teams, if you're in a position to do that, and really try and develop resilient teams. Whether you're in a team of 2 or a larger team, it will make such a tremendous difference moving forward. I do believe that.
Thank you. Sarah Willis.
Thanks, Susan. So I guess I haven't got much to add, except I'm really struck by Vibhuti's comment about reflection being a privilege, and Dahlia's kind of adding to that. And that's something that's really resonated with me, and I'm going to reflect on that more. So I haven't got any advice, but I am going to reflect on my privilege and my privilege to be able to reflect on my privilege.
Yeah. So you're going to take some advice from this.
I am.
Excellent. Let me turn it next over to the representative of the Y chromosome on this thing. Kyle, what are your thoughts?
You know, I didn't even realize that. My thought is it's all about planning. Again, coming out of COVID in New Zealand, it just shows that it's really a clear plan is what we need. So Vibhuti and I have just done a project plans in education, and how many strategic plans have put in resilience and readiness, and maybe not shockingly, very few have actually done that. So I think moving forward as a profession, whether it's education or practice sector, we really need to bring these words and these concepts into our planning.
Thank you. And I will leave the last word for Catherine Duggan. Catherine.
Thank you so much, Zubin. And I haven't got a microphone with me today, so I promise you there will be no singing involved. I've got three mini reflections. So when I think of the word grit, I have 2 definitions. One is a small, loose particle of stone or sand, and the other is courage and resolve and strength of But for resilience, when you find a bit of grit in your shoe, you don't keep going. You pause, you take the grit out, and you can proceed. My second reflection is grit. Gratitude, reflection, insight, and tenacity. And my third reflection, just to add a little bit of lightheartedness, is that between the G and T, I see real insight today.
Well, thank you so much for that. I'm going to conclude shortly, but I'm not going to use my own words to thank the panelists or to thank all of you for attending. I'm going to quote one of the members of the audience actually right now, and that's Day John, who has written, "Thank you to each one of you, the panelists, on this panel. This has been an incredibly useful and interesting. Now, for each one of you panelists to recharge your batteries, whether it be lunch, breakfast, dinner, bed, cocktail, or more than any of the above, and please forgive the following word, diolch, thank you. Thank you to all of the panelists. Thank you to FIP for supporting this event. Thank you very much to you for attending. I wish all the best for everyone and look forward to seeing you at the next FIP webinar. Thank you very much."
Thank you.